Hello, today we'll talk about the arterial system of the body. We will talk about every single artery in our body. Let's go. Considering the heart as the center of the cardiovascular system, so let's get some adequate exposure. The heart sits in the thorax, anterior to the vertebral bodies. Its superior part is approximately in the line with the T4-T5 intervertebral disc, and its most anterior part with the T8-T9 disc. This varies a bit with positioning and respiration, but it's a pretty good average. There are main four groups of vessels that are involved in carrying blood into and out of the heart. Draining into it are the pulmonary veins, which carry oxygenated blood from lungs to the heart. They are the only veins which have oxygenated blood. They drain blood into the left atrium of the heart, and the superior and inferior vena cava, which drain into the right atrium. And draining out of the heart are the pulmonary artery, which drain non-oxygenated blood from the right ventricle of the heart to the lungs to be oxygenated. It is the only artery which carries non-oxygenated blood, and the aorta, which drains oxygenated blood from the left ventricle of the heart to the rest of the body. Today we are going to have a look at the aorta and its branches. The aorta can be divided into three segments, from proximal to distal. These are the ascending aorta, the aortic arch, and the descending aorta. From the aortic arch, there are three recognizable branches. The first and largest is the brachiocephalic trunk. This will later branches to supply the arm and the head of the right side. It's named brachiocephalic from brachio, which meaning arm, and cephalic, which meaning head. Next we have the left common carotid, which will supply the head and the neck on the left side. This gets its name from the Greek root kairos, which means sleep or stupor, deriving from the fact that blockage of this artery will lead very quickly to loss of consciousness. Lastly, we have the left subclavian artery, which supplies the left arm. Here is a demonstration of how the aorta relates to the heart. See how its descending part passes posteriorly and the left side of the vertebral body. Don't forget that the common carotid and subclavian arteries on the left side arise directly from the aortic arch. Before we leave this part, let's have a look into the coronary arteries, which supply the heart itself with blood. These arteries originate from the base of the aorta, just above the aortic valve. They subdivided mainly into the right coronary artery and the left coronary artery. The left coronary artery branches into two major vessels. Left anterior descending lead artery supplies the front part of the heart, including the left ventricle and interventricular septum, and the left circumflex artery. It circles around the heart, supplying the left ventricle and part of the posterior wall. Right coronary artery, which supplies blood to the right atrium, right ventricle, parts of the left ventricle, and the conduction system including the ACE node and the AV node. In the thorax, the aorta is called the thoracic aorta, which give numbers of small branches. The most important to be aware of right now are the 3rd to 11th posterior intercostal arteries, which supply the corresponding intercostal spaces. The other branches in ascending order: bronchial arteries. These are paired visceral branches arising laterally to supply bronchial and peribronchial tissue and visceral pleura. Mediastinal arteries, small arteries that supply the lymph glands and loose areolar tissue in the posterior mediastinum. Esophageal arteries, unpaired visceral branches arising anteriorly to supply the esophagus. Pericardial arteries, small unpaired arteries that arise anteriorly to supply the dorsal portion of the pericardium. Superior phrenic arteries, paired branches that supply the superior portion of the diaphragm. At the level of T12 vertebra, the aorta enters the abdominal cavity from the aortic hiatus on the diaphragm and named as the abdominal aorta. It's approximately 13 cm long and ends at the level of L4 vertebra. At this level, the aorta terminates by bifurcating into the right and left common iliac arteries that supply the lower body. Let's have a look at the branches of the abdominal aorta. They are in descending order: the inferior phrenic arteries, paired arteries arising posteriorly at the level of T12, they supply the diaphragm. The celiac artery, a large and paired visceral artery arising anteriorly at the level of T12. It's also known as the celiac trunk and supplies the liver, stomach, abdominal esophagus, spleen, and the superior duodenum and the superior pancreas. This is the superior mesenteric artery, a large and paired visceral artery arising anteriorly, just below the celiac trunk. It supplies the distal duodenum, jejunum, ascending colon, and part of the transverse colon. It arises at the lower level of L1. Middle suprarenal arteries, small paired visceral arteries that arise either sides posteriorly at the level of L1 to supply the adrenal glands. Renal arteries, paired visceral arteries that arise laterally at the level between L1 and L2, they supply the kidneys. Gonadal arteries, paired visceral arteries that arise laterally at the level of L2. Note that the male gonadal artery is referred to the testicular artery, and in females, the ovarian artery. Then the inferior mesenteric artery, a large and paired visceral artery that arises anteriorly at the level of L3. It supplies the large intestine from the splenic flexure to the upper part of the rectum. The median sacral artery, an unpaired parietal artery that arises posteriorly at the level of L4 to supply the coccyx, lumbar vertebrae, and the sacrum. And lastly, the lumbar arteries. There are 4 pairs of parietal lumbar arteries that arise posterolaterally between the level of L1 and L4 to supply the abdominal wall and spinal cord. Now, let's see the celiac trunk with more details. It arises from the anterior aspect of the aorta, at the aortic hiatus of the diaphragm, at the level of T12. After emerging from the aorta, the celiac trunk extends approximately 1 cm before dividing into 3 major branches: left gastric, splenic, and common hepatic arteries. They are the major arterial supply to the stomach, spleen, liver, gallbladder, abdominal esophagus, pancreas, and duodenum. Let's see the left gastric artery. The left gastric artery is the smallest of the 3 branches. It descends across the diaphragm, giving rise to the esophageal branches, before continuing anteriorly along the lesser curvature of the stomach. Here it anastomoses with the right gastric artery. The splenic artery arises from the celiac trunk just inferior to the left gastric artery. It then travels left towards the spleen, running posterior to the stomach and along the superior margin of the pancreas. It terminates into 5 branches which supply the segments of the spleen. In addition to supplying the spleen, the splenic artery also gives rise to several important vessels. The left gastroepiploic, which supplies the greater curvature of the stomach, anastomoses with the right gastroepiploic artery. The short gastrics, 5 to 7 small branches supplying the fundus of the stomach, and the pancreatic branches supply the body and tail of the pancreas. The splenic artery has a tortuous appearance and thus is easily identifiable from the other nearby vessels. Now let's have a look at common hepatic artery, which is the sole arterial supply of the liver, and the only branch of the celiac artery to pass to the right. As it travels posterior to the superior aspect of the duodenum, it divides into its 2 terminal branches, the proper hepatic and gastroduodenal arteries. Each of these arteries has multiple branches, and variation in the arrangement of these branches is common. Right gastric artery, which supplies the pylorus and lesser curvature of the stomach. Right and left hepatic arteries divide inferior to the porta hepatus and supply the respective lobes of the liver. The cystic artery, which is a branch from the right hepatic artery, supplies the gallbladder. And lastly, the gastroduodenal artery. It descends posterior to the superior portion of the duodenum. Its branches are the right gastroepiploic, which supplies the greater curvature of the stomach. It's found between the layers of the greater omentum, which it also supplies. And the superior pancreatico-duodenal artery divides into the anterior and posterior branches which supplies the head of the pancreas. Let's go to see the superior mesenteric artery. It is the second of the 3 major anterior branches of the abdominal aorta. It arises anteriorly from the abdominal aorta at the level of L1 vertebra, immediately inferior to the origin of the celiac trunk. After arising from the abdominal aorta, the superior mesenteric artery descends down to the posterior aspect of the abdomen. It gives rise to various branches that supply the small intestine, cecum, ascending, and part of the transverse colon. The first branch is the inferior pancreatico-duodenal artery. It forms anterior and posterior vessels, which anastomose with a branch of the superior pancreatico-duodenal artery, which is derived from the celiac trunk. This network supplies the inferior region of the head of the pancreas, the onychinated process, and the duodenum. Jejunal and ileal arteries. The superior mesenteric artery gives rise to numbers of arteries that supply the jejunum and ileum, and the middle and right colic arteries. They arise from the right side of the superior mesenteric artery to supply the colon. The middle colic artery supplies the transverse colon, and the right colic artery supplies the ascending colon. And lastly, the ileocecal artery. The ileocecal artery is the final major branch of the superior mesenteric artery. It passes inferiorly and to the right, giving rise to branches to the ascending colon, appendix, cecum, and ileum. In cases of appendectomy, the appendicular artery is ligated. Let's see the last of the 3 major anterior branches of the abdominal aorta, which is the inferior mesenteric artery. It arises at L2 near the inferior border of the duodenum, 3 to 4 cm above where the aorta bifurcates into the common iliac arteries. The branches from the inferior mesenteric artery supply the structures of the embryonic hindgut. These include the distal 1/3 of the transverse colon, splenic flexure, descending colon, sigmoid colon, and rectum. There are three major branches that arise from the inferior mesenteric artery (IMA), which are the left colic artery, sigmoid artery, and superior rectal artery. The left colic artery dividing into ascending and descending branches. The ascending branch supplies the distal 1/3 of transverse colon and the upper aspect of the descending colon, as the descending branch moves inferiorly to supply the lower part of the descending colon. The sigmoid artery supplies the descending colon and the sigmoid colon. Let's see the superior rectal artery. The superior rectal artery is a continuation of the inferior mesenteric artery, supplying the rectum. It descends into the pelvis, crossing the left common iliac artery and vein. At the S3 vertebral level, the artery divides into two terminal branches, one supplying each side of the rectum. At around the level of L4, the abdominal aorta bifurcates into two divisions that birth common iliac arteries. These themselves divide into the external iliac arteries, which supply most of the lower limb, and the internal iliac arteries, which supply the pelvis and the reproductive organs. Before we seeing the arteries of the lower limb, let's have a look on the internal iliac artery. It is the major artery of the pelvis. It originates at the bifurcation of the common iliac artery into the internal and external branches. This approximately occurs at the level of L5 and S1. The artery descends inferiorly, crossing the pelvis inlet to enter the lesser pelvis. During its descent, it's situated medially to the external iliac vein and the obturator nerve. At the superior border of the greater sciatic foramen, it divides into anterior and posterior trunks. The anterior trunk gives rise to numerous branches that supply the pelvic organs, the peritoneum, and the gluteal and adductor region of the lower limb. Let's see the branches of the internal iliac artery. The obturator artery, it supplies the muscle of the size adductor region. The umbilical artery gives rise to the superior vesical artery, which supplies the superior aspect of the urinary bladder. The inferior vesical artery supplies the lower aspect of the bladder. In males, it also supplies the prostate gland and seminal vesicles. Vaginal artery in female descends to the vagina, supplying additional branches to the inferior bladder and rectum. Uterine artery in female to supply the uterus. Middle rectal artery in male and female. It travels medially to supply the distal part of the rectum. It also forms anastomosis with the superior rectal artery, which derived from the inferior mesenteric, and the inferior rectal artery, which derived from the internal pudendal artery. And it's the internal pudendal artery. It is the main artery responsible for the blood supply of the perineum. Lastly, the inferior gluteal artery, which is the terminal branch of the anterior trunk. It contributes to the blood supply of the gluteal muscles and hip joint. Let's see the posterior trunk. The posterior trunk gives rise to arteries that supply the lower posterior abdominal wall, posterior pelvic wall, and the gluteal region. There are typically three branches. The iliolumbar artery. It divides into lumbar and iliac branches. The lumbar branch supplies the psoas major muscle, quadratus lumborum muscle, and the posterior abdominal wall. The iliac branch supplies the muscles and bone around the iliac fossa. The lateral sacral arteries, which are superior and inferior. They supply structures in the sacral canal and the skin and muscle posterior to the sacrum. And lastly, the superior gluteal artery, which is the terminal branch of the posterior trunk. It's the major blood supply to the muscles and skin in the gluteal region. Let's go to see the arterial system of the lower limb. As the external iliac artery passes under the inguinal ligament and thus leaves the pelvis, it's become known as the common femoral artery. Let's follow the common femoral artery down into the lower limb. The common femoral artery produces two main branches to the leg. The first is the superficial femoral artery, sometimes just called the femoral artery, and largely responsible for the blood supply of the anterior compartment of the thigh, and passes posteriorly to the knee, as known as the popliteal artery. It also produces a branch known as the deep femoral or profunda femoris artery. This produces branches that are mostly responsible for supplying the posterior compartment of the thigh. Branches from the deep femoral artery include the lateral circumflex femoral artery, which has an ascending branch to the hip, and descending branch to the medial circumflex femoral artery, which also supplies the hip. Continuing inferiorly, we can see the popliteal artery, sited just behind the knee. The popliteal artery produces three main branches, which are the posterior tibial artery, which supplies the posterior compartment of the leg, the fibular artery, which supplies the lateral compartment of the leg, and the anterior tibial artery, which supplies the anterior compartment of the leg. The anterior tibial artery also produces dorsalis pedis artery, a branch which runs over the dorsum of the foot. The posterior tibial and dorsalis pedis arteries are commonly palpated during the cardiovascular examination, of course in addition to the popliteal and femoral arteries. In the foot, the posterior tibial artery branches into the medial plantar artery and lateral plantar artery. The medial plantar artery supplies blood to the medial aspect of the foot, including two. The lateral plantar artery supplies blood to the lateral side of the foot and joins the other branches to form the plantar arch, also called the deep plantar arch, which further supplies blood to the toes and the plantar aspect of the foot. The peroneal or fibular artery is a branch of the posterior tibial artery. The peroneal artery runs along the lateral side of the lower leg and supplies blood to the lateral compartment of the leg and foot, and gives off small branches that contribute to the blood supply of the foot, particularly the lateral and plantar aspects. It is the plantar arch. The plantar arch is formed primarily by lateral plantar artery from the posterior tibial artery and deep plantar artery, a branch of the dorsalis pedis artery. The plantar arch supplies the plantar surface of the foot, including the toes. And these are some key branches: the digital arteries, which branching from the plantar and dorsalis pedis and provides blood to the toes. The deep plantar artery, a branch of the dorsalis pedis artery that contribute to the plantar arch. The arcuate artery, a branch of the dorsalis pedis that supplies blood to the metatarsal region. Okay, let's go all the way back to the heart and look at those branches that come from the aortic arch. At the right side, the brachiocephalic trunk gives rise to two arteries. The first runs deep to the clavicle bone, so is known as the right subclavian artery, and the second goes up to the neck to supply the head and is known as the right common carotid. An important branch from the subclavian artery is the thyrocervical trunk, which supplies part of the thyroid gland and some surrounding muscles. Other branches including the vertebral artery and costocervical trunk. Don't forget that the common carotid and subclavian arteries on the left side arise directly from the aortic arch. An important branch from the subclavian artery is the internal thoracic or mammary artery. It runs down to the anterior chest wall, traveling along the side of the sternum. As it reaches the level of the breast, it gives several branches that supply the medial inner part of the breast, including the perforating branches. These branches penetrate the chest wall and supply the inner portion of the breast tissue, including the nipple areolar complex. Let's follow the subclavian artery into the arm. And before we follow it, don't forget to follow me and subscribe my YouTube channel to keep in touch with me and my videos. The proper name for our armpit is the axilla. So as this artery passes through the armpit, it is known as the axillary artery. It continues down the medial aspect of the arm, and at the level of teres major muscle, it becomes known as the brachial artery, which supplies the anterior compartment of the arm. The axillary artery produces two important branches, known as the posterior and anterior circumflex humeral arteries. These do a similar job to the circumflex femoral arteries at the lower limb in supplying blood to the neck of the humerus, rather than the neck of the femur in the lower limb. One of the important branches of the axillary artery is the lateral thoracic artery, which runs along the lateral side of the chest and supplies blood to the lateral part of the breast. It also supplies the pectoral muscles and some of the axillary lymph nodes. This artery is especially important in supplying the upper outer quadrant of the breast. Another important branch from the axillary artery is the sarcocromial artery. It provides several branches, including the pectoral branches, which supply blood to the breast tissue, particularly in the upper and central portion of the breast. It also supplies the pectoral muscles. And the brachial artery produces a branch known as the deep brachial or profunda brachii artery, which supplies the posterior compartment. This continues down to the lateral arm as the radial collateral artery. And there is the radial recurrent artery. Lastly, on the medial side, the brachial artery produces a branch that travels around the back of the elbow and is known as the superior ulnar collateral artery. Okay, we are nearly done. In the medial side of the forearm, the brachial and superior ulnar collateral arteries join to produce the ulnar artery, which supplies blood to a lot of the anterior compartment of the forearm. On the lateral side of the forearm, the radial recurrent artery joins the brachial artery to produce the radial artery. This mostly helps to supply the blood of the posterior compartment. Eventually, the radial and ulnar arteries join in the hand to produce deep and superficial palmar arches. From the ulnar artery comes the common interosseous artery, which branches into anterior and posterior divisions. This sites at the interosseous membrane, which is between the ulna and radius bone, and again mostly supply the posterior compartment. At the hand, there are two main palmar arches. Superficial palmar arch, formed primarily by the ulnar artery and a contribution from the radial artery. It supplies the palmar side of the fingers. The deep palmar arch, formed mainly by the radial artery with some contribution from the ulnar artery. It supplies the deeper structures of the palm, including the thumb and part of the index finger. The palmar arches gives rise to digital arteries, which supply the fingers. The digital arteries run along the side of the fingers, providing blood to the phalanges and the soft tissue. The proper digital arteries supply blood to the sides of each finger, while the common digital arteries branch off from the arches and split into proper digital arteries. At the dorsal of the hand, there are the dorsal hand arteries. The dorsal carpal arch is a network of arteries located on the back of the hand, primarily formed from the radial and ulnar arteries. This arch gives rise to the dorsal digital arteries, which supply blood to the dorsal surface of the fingers. The dorsal hand also receives blood from small branches of radial and ulnar arteries. Okay, let's follow our last major artery. It is the common carotid artery and runs up at either side of our neck. It supplies our head and neck. It is better reviewed from the side. It doesn't produce any branches until it reaches your jawbone, and then it splits into the internal and external carotid arteries. Let's see the branches of the external carotid artery. There are 8 branches from the external carotid artery. You need to remember them, but don't worry, we have a helpful mnemonic to help you to remember them. The first branch from the external carotid artery is the superior thyroid artery, followed by the ascending pharyngeal artery. Next we have the lingual artery, which supplies the tongue. The facial artery, which supplies the lower part of your face. The occipital artery supplies the occiput, and the posterior auricular artery supplies the back of your ear. Finally, the maxillary artery passes deep to the maxilla to produce numerous important branches, and the superficial temporal artery supplies your temple. The mnemonic we are used to remember these arteries is some anatomists like freaking out for medical students. This is very true, and it should help you to remember it when it comes to revision time. Let's have a look at the most important branches of the internal carotid artery, which is the major blood supply to the brain, eyes, and other parts of head, unlike the external carotid artery, which supplies the face and neck. The cervical part of the internal carotid artery has no branches. At the petrous part, there are carotico-tympanic arteries. These small branches supply the middle ear and the tympanic cavity. At the lacerum part, no significant branches. This portion of the internal carotid artery passes through the foramen lacerum, and there are no major branches given of hair. The cavernous part. At the cavernous part, it gives cavernous branches. This supplies the cavernous sinus and the surrounding structures. And now we get the cerebral part, the intracranial branches. Once the internal carotid artery enters the cranial cavity, it gives off the following major branches. The ophthalmic artery, which supplies the orbit, eyes, eyelids, and other structures. The frontal region of the skull and parts of the nasal cavity. The posterior communicating artery. This connects the internal carotid artery with the posterior cerebral artery, and it's a part of circle of Wells. The anterior choroidal artery supplies the choroid plexus, part of the thalamus, and internal capsule. The middle cerebral artery, one of the largest branches of the internal carotid artery. It supplies a significant portion of the lateral cerebral cortex, including the motor and sensory areas of the face, upper limbs, and parts of the temporal and parietal lobes. The anterior cerebral artery. This artery supplies the medial and superior parts of the frontal lobes and the paracentral lobule. It is connected to the opposite side via the anterior communicating artery, completing the circle of Wells. The circle of Wells is a circular network of arteries located at the base of the brain that provides collateral blood flow to the brain. It's formed by the anastomosis of several arteries, ensuring that if one artery is blocked or narrowed, the blood supply to the brain can still be maintained by other routes. The circle of Wells is important for maintaining adequate cerebral circulation and minimizing the risk of brain ischemia. The circle of Wells is formed by the following arteries: the internal carotid arteries, the anterior cerebral arteries, the middle cerebral arteries, the posterior cerebral arteries, the vertebral arteries, and finally the basilar artery, which is formed by joining the two vertebral arteries and is located at the base of the brain. It supplies the brainstem and cerebellum and gives rise to the posterior cerebral arteries. The blood supply of the vertebral column and the spinal cord are mainly from the vertebral arteries, which arise from the subclavian arteries. They play a significant role to supply blood to the cervical portion of the spinal cord. There are spinal branches of the vertebral arteries, which arise from the vertebral arteries, and they pass through the foramen magnum into the cranial cavity. The segmental arteries are branches of the subclavian, aortic, and lumbar arteries that provide blood to the spinal cord from the cervical to the sacral regions. The posterior spinal arteries and the anterior spinal arteries, the radicular arteries, they all involve in the blood supply of the spinal cord and the vertebral column. Okay, that was a whistle-stop tour of all of the major arteries of the human body. In the future sessions, we will cover the arterial supply of every part of the body in details, and we will talk about the venous system of our body. Also keep your eyes peeled for part 2 of the series, where we will cover the major veins. For now, get yourself a cup of tea and see how many of arteries we discussed that you can still remember. If you enjoyed the session, remember to subscribe and have a great day. Goodbye.